Hello, world changers. I hope you're all well and you're all ready for this exciting Facebook Live that we've got with Dr. Alan Desmond. Now, Alan is going to be speaking at the Change Your World conference in 3 weeks' time, and he's just going to give us a flavour of what he does. Basically, Alan's just joined there. I'll be inviting him on a second. So Alan's going to give us a flavour of how we can live a more healthier, happier life just by transforming our gut health. So I'm not going to waffle on any longer because it's Alan we want to see. So let me invite him on. Give me a second. Hi Joe, it's nice to see you. Let me make sure I bring on Alan and not. I think you'd freak out at that if I did that to you, Joe. So I was just connecting just now. So, hey, Alan.
Hi, Suzy. I didn't think you were waffling.
Well, it's just when you're talking into the ether here, like, wow.
I know.
So, yes, please feel free to like, comment, and share if you've got any questions for Alan. So, I'm going to hand over to you, actually, and just let you tell us a little bit about yourself, what you do. And how you...
Yeah, thanks, Suzy. Well, first of all, I'm really looking forward to the conference in a few weeks' time. I can't believe it's only 3 weeks to go.
Me neither.
I'm sure it's all organised. I'm sure it's all sorted. Yeah, everything's in order. Of course it is.
Totally.
All the flights booked and all the rest
Completely.
of it. So
HQ.
Well, I'm a consultant gastroenterologist. So I'm a doctor who treats people with abdominal problems, stomach problems. I do a lot of diagnostic endoscopy. I put a lot of cameras inside people's gut to have a look and diagnose them with problems. I see patients with everything from diverticular disease, irritable bowel syndrome, Crohn's disease, ulcerative colitis, any sort of digestive disorder, really. I spend a lot of my time meeting people who have what we call functional GI problems, so sort of sometimes labeled as irritable bowel syndrome, which I sometimes call irritable food syndrome, but we can talk about that more later. And unfortunately, I spend quite a lot of my time diagnosing people with serious problems, such as stomach cancer, colon cancer, and pancreatic cancer. And I think, as someone who's been doing this now for a long number of years, well, don't make myself sound too old, but I've been doing this for a number of years. Well, the fact that, diet and lifestyle are so key to the prevention of many of these conditions has really sort of lit a fire under me. Okay. So now, when my patients come and see me, they don't just get a standard gastroenterologist with tests and scans and scopes, although I do all those things. Yeah. And they don't just get a prescription, although I do write a lot of prescriptions. But I always try and give my patients evidence-based dietary advice to go with the medical therapy, often instead of the medical therapy. Well, I think this past week I prescribed a green smoothie 3 times.
Well, we can treat conditions with diet rather than put people on medication, then that has got, the Change Your World is all about the ripple effect, but it's great for the patient, it's great for the NHS, it makes such a huge ripple effect.
Well, if I sit down with a patient, Suzy, and I say, okay, well, look, here's the problem, this is what we think is wrong, I can give you a prescription, or I can give you some evidence-based dietary advice, and you do the work. What would you rather?
Yeah.
90% of the time, people say, well, look, give me the evidence-based dietary advice, and then they go with it. And sometimes that might need some medication as well, that might need a fiber supplement as well, that might need a probiotic supplement as well, but all those things really are just kind of temporary fixes while that person is making healthy dietary change.
Yeah. Okay, so tell us, you were going to talk about gut microbiome, is that right?
Yeah, well, I thought for tonight, rather than just trying to cover everything, we would just talk about the microbiome, because it's such an interesting topic. So should we go for it?
Go for it. Go for it. Explain to us, what is microbiome?
Yeah, well, as I said to you earlier today, we are not alone. We have inside our gastrointestinal tract billions of bacteria. 10 to the power 14 bacteria. That's 10 with 14 zeros after it.
Wow.
So that's more bacteria living inside our bodies than there are stars in the Milky Way. So it's a huge, our microbiome.
Such a visual
Yeah.
when you put it like that,
Yeah.
and that's all just going on inside us, working away behind the scenes, and we don't even, we're not even thinking about it. We're not even aware of what we're...
Not even aware of it. There's, as I said to you earlier on today, if I was able to draw a circle around you right now, inside that circle, there is 10 times more microbial cells than human cells, and there's 100 times more microbial genetic material than there is human genetic material. So we are more microbe than human. And it's not just bacteria, there's also viruses, yeast, and a particularly ancient form of microbe called archaea. And these things live within us, and they're living with us in a perfect symbiosis. We need them.
Yeah. I mean, is their role to keep us healthy? Is that what they're doing all the time?
Well, from the very beginning. So when we're born, we don't have many bacteria in our gastrointestinal tract. There's some evidence that there's some in there already in utero, if you can believe that, getting to us across the placenta. Right. But even when the gastrointestinal tract is developing, it's dependent on certain bacteria. For example, there's a bacterium called Bacteroides theta, and if it's not there when the gastrointestinal tract is forming, the gastrointestinal tract doesn't form its blood supply properly. And although I hate mentioning animal experiments, because I've never done animal experiments, I'm not a fan of them, but we know that in the laboratory, if animals are raised in a germ-free environment, they have no microbiome, their gastrointestinal tract doesn't develop properly. Okay. So we need those bacteria. They're a key contributor to human metabolism and health, and an essential part of being a whole, healthy human.
Okay, so I'm going to just say hello to a couple of people that have joined us. We've got Diane, Stefan, Sunju.
And Elizabeth. Hi, Elizabeth.
You know Elizabeth? Okay, great. So
I do.
If you have any questions for Dr. Alan Desmond, our Devon gut doctor, please put them in the comments below. But we're talking all about gut health here today. So essentially, how can we keep our... Okay, well, let's talk about what...
Well, let me tell you a few things that a healthy microbiome does for you. Okay. Yeah, so why is it a good idea to have a healthy microbiome, and how does that work? So I said earlier, my top tip, fiber, okay? So when we eat fiber, and not everybody eats enough fiber, the national guideline is that we should consume 30 grams of fiber per day, but 80 to 90% of people don't make it. 80 to 90% of people are fiber deficient. People always worry about B12 deficiency and calcium deficiency and vitamin D deficiency, but the 80% of people in the UK are fiber deficient. They're not getting enough fiber. So why is that bad news for your microbiome? When we eat fiber, the fiber-loving bacteria in our gut digest that fiber into short-chain fatty acids. Without those bacteria, we wouldn't have any short-chain fatty acids in our body. And here's four things that the short-chain fatty acids do. Number one, they're the primary energy source for the cells lining our large bowel. So that's where they get their energy. They get their energy from the bacteria digesting fiber. Okay. The short-chain fatty acids, which are generated by the fiber-loving bacteria, actually have special receptors. They bind to cells lining our bowels, the L cells, and they promote the production of hormones and peptides like glucagon-like peptide and peptide YY. So these signals go through our bodies and actually signal us to reduce our energy consumption and to stimulate a little bit of insulin production. So the fiber's feeding the microbiome's feeding our bowel. Okay, you're losing me. It's helping us to regulate our blood sugars.
Layman's term, you're losing me a bit here. What's happening?
So essentially, by eating fiber, our gut microbiome will grow more bacteria that love fiber, and they'll generate short-chain fatty acids, which go through our system, help us to reduce our appetite, control our caloric intake, help us to regulate our blood sugars, bind to immune cells and encourage them to maintain a healthy gut barrier, that little lining that keeps the keeps the harmful stuff in the gut and not getting into our system. Okay. And even the short-chain fatty acids even do things like encourage the lining of our bowel to sort of breathe and use up any nearby oxygen, keeping the oxygen levels in the gut low, which is just what the healthy bacteria like. So you're eating fiber, you're thinking, oh, I'll have a nice big bowl of beans here. You don't realize that the fiber is actually interacting with the microbiome, which is then interacting directly with your body to give you all of these benefits, you know? So if you say again?
Understanding this right, you would get energy from this, you would reduce sort of cravings, so you not overeating, you would feel fuller, it would keep you healthier, so things like you'd be less resistant, you know, more resistant to colds, flus, other conditions.
Well, I guess the interesting thing would be, so what happens in the opposite scenario? Yeah, so if you're on a very fiber deficient diet, as many people are, what happens in terms of the short chain fatty acids and the fiber production and the microbiome? So what happens, you don't get those signals to reduce your caloric intake, you get poor blood sugar control, the gut barrier breaks down. You've heard of leaky gut syndrome. So you get stuff that's in your bowel getting through the bowel and into your systemic circulation, circulating in your body and increasing systemic inflammation. Now, a good example of that is coronary vascular disease. You get these little atheromatous plaques in your body. Now, there's lots of reasons for that. But it's really interesting that if you take those plaques out of someone's heart, they've got heart disease, you put them under the microscope and analyze them, you can find gut bacteria, genetic material in there. So that's why an unhealthy diet, a low fiber diet, it's just one of the reasons that it can predispose to chronic disease.
Okay, so earlier when we spoke, you mentioned about some of the conditions that a poor gut health can create. So again, for the people that are listening just now, give us the list again, because it was quite shocking. I had no idea that it could create that amount of level of disease and.
Yeah, well, I guess some of the conditions that I'm particularly interested in: diverticular disease, colon cancer, stomach cancer, pancreatic cancer, Crohn's disease, ulcerative colitis. All of these conditions, your risk of having these are hugely magnified by having an unhealthy diet. And when I say unhealthy, I hate using that term really, but maybe a suboptimal diet, you know? So if you're eating a healthy diet, then for example, stomach cancer, terrible condition, okay? I diagnose people all the time. It's very sad, it's never easy. It's very hard to survive stomach cancer. But Cancer Research UK estimate that about 75% of cases of stomach cancer are completely preventable by healthy diet and lifestyle, you know? And that's about a fiber-rich diet, avoiding processed meat, avoiding over-salted foods, keeping your alcohol intake to a minimum, but also not smoking. So if we could get everybody to do that, we would cut the number of cases of stomach cancer by 75% in the UK, which is incredible.
Yeah.
And that's without prescribing a pill or
and I mean, these
putting
are
anyone
not
on medication.
Big changes. You know, cutting out processed meat, that, you know, we can do that. We can.
Oh yeah.
Salt. I mean, salt, was that another one you mentioned?
Yeah, well, I guess that goes hand in hand with the processed meats and certain other foods. But so processed meat, it's like it's a bugbear of mine. Okay, so lots of people love their bacon and their sausages. And if you tell them to not eat them, they get a little bit offended, and I apologize for that. But the sad fact is that those foods are carcinogenic, and that's not a controversial statement. The World Health Organization, the various independent expert bodies who've looked at that have said this is a fact. You know, if you just eat one serving of processed meat a day, so that's a ham sandwich, a sausage, or a couple of slices of bacon. Or if you eat 5 sausages and 8 slices of bacon at the weekend,
and this is
that's enough.
Smoking.
That's enough to increase your risk of colon cancer by 20 to 50%.
Wow, and that, I mean, that is something that can be cut out. And you know, if you are a meat eater, you can enjoy other meats without it having to have that. So, what are your top tips for? I mean, okay, the whole thing about a healthy diet, there's so much confusion about nutrition, and depending on which expert you talk to, you will get a different opinion on what is healthy and what's not. Oh, have I lost you? Are you back?
Are you back?
I think you're just cutting out. Hello?
Are you there?
Yes, and then brilliant, you're back. Yeah, I was just saying that, in terms of nutrition, like depending on which expert you speak to, you get such conflicting advice, you get different advice. How, as an individual, do you know who to trust, what to do, and what to eat and what not to eat? Who do we believe?
It's really tough. One set of guidelines that can be really useful are the UK Eat Well Guide. Okay, the NHS Eat Well Guide. So this is Public Health England, 2014. Spent a number of years just analysing all of the dietary studies, and trying to determine what the healthy changes that the UK needs to make are in order to try and improve the health of the nation. So if you look at their recommendations, you'll see a few interesting things. They recommended cutting out processed meat. Yeah. They recommend that if you do choose to eat red meat, that you keep it to less than 200 grams a week. So that's 2 Dexaplane cards per week, if you choose to eat it. They recommended that we increase our intake of beans, peas, split peas, and lentils, that's legumes, by 2-fold. They recommended that we cut our consumption of meat by 78% and double our intake of fruit and veg. Alongside reducing our intake of ultra-processed foods, we can talk more about ultra-processed foods if you'd like to.
Yeah, definitely.
And avoiding the excess free sugars, the sugary sweets and everything. Now, when they wrote those guidelines, they did a huge body of work, and they estimated that if they could get in a magic world where they could wave a wand and get everybody to eat like that, in 10 years, we would prevent 170,000 cases of colon cancer, 40,000 cases of pancreatic cancer, 40,000 cases of breast cancer, and tens of thousands of cases of coronary vascular disease and type 2 diabetes. So this is powerful stuff. If I had some pills that could achieve all that, it would be, I'd probably get the Nobel Prize. But you don't need a pill to do it. You just need to look at what's in your shopping trolley and move in that direction. Now, as you know, Suzy, I'm a big advocate for people eating a plant-based whole food diet, which really encapsulates the healthiest possible version of the NHS Eat Well plate. Yes.
So I'm interested about this because you do advocate the plant-based diet, you do treat your patients. So tell me, without breaking any confidentiality, but tell me about some of the cases that you deal with and how they are treated with a plant-based diet, and how your patients respond to this kind of advice.
Well, I have to say, it's I think when you're dealing with individual patients, you have to meet them where they are. If I get a patient who's been diagnosed with ulcerative colitis, and I know from the evidence that if I know from studies like the Harvard Nurses study and the E3N study in France, so I know that eating a high animal protein, low fiber diet, which is rich in processed meat and processed foods, so I know from the existing medical evidence, which isn't controversial, that that dietary pattern is causative in ulcerative colitis and exacerbates the course of the condition. And I know that this person will do better by moving as far as they can towards a plant-based whole food diet. That's fine. But if I have this gentleman sit in front of me and he has bacon every day for breakfast, and he has off-the-shelf pasty for his lunch, and then he has chips and burgers for tea, I'm not going to take him in 20 minutes from that to whole food plant-based.
Yes.
So it's a process.
Yes.
And I think often, unfortunately, our dietary patterns are, unfortunately, it's not anybody's fault. This is the food we're marketed, this is the food we're sold, this is the food that's advertised as good, So, for example, ultra-processed foods. Okay, so ultra-processed foods are things like packaged cakes and baked goods that sit on the shelf with a wrapper on them and they don't go stale. Fizzy drinks, sweets, the American Twinkie, instant noodles, meat pies, sausage rolls. These are foods that are produced by industrial processes. Essentially anything with more than 5 ingredients. grains, let's say,
Yeah.
is an ultra-processed food.
Yeah.
So those foods contain things which predispose to ulcerative colitis and Crohn's disease. Okay? That's just a fact.
Wow.
You know? But right now in the UK, we get 55% of our calories from ultra-processed foods.
50.
And 1 in 55% of our calories, those are figures just released earlier this year. And 1 in 5 people get 80% of their calories from ultra-processed foods.
Wow.
You know? So often for me and my patients, that conversation will start with, how many pieces of fruit do you eat a day? Sometimes the answer is none. How many servings of vegetables do you eat per day? Sometimes the answer is none. You know, then we move on to dairy, fish, red and processed meat, and whole grains. So whole grain consumption, one of the key determinants of human health and longevity. A lot of people don't eat any whole grains. Yeah. I'm not blaming people. Yeah. It's not that these people are deliberately avoiding these foods. It's just that they've been educated not to have them on their plate.
And they've not, you know, these foods don't get advertised. We're not constantly marketed to and conditioned to, and not, you know, we're told a certain ways, or a glitzy package, it looks healthy, you know, looks great, and it's convenient as well, you know.
It's convenient. I mean, I was walking past my daughter's school last year, and there was a big poster on the bus stop, and it was a McDonald's breakfast. It had like the white bun, no whole grains. It had cheese. We haven't talked about dairy and gut health today, but it had a whole bunch of cheese, bacon, kind of a sausage patty squeezed into a bun. And then it says McDonald's breakfast sorted, you know. And my kids are walking past it on the way to school, you know. So that's what they see advertised as breakfast. You're not going to see you're not going to see a poster for a bowl of porridge with walnuts on top that says breakfast sorted. Yeah. You know, and I wish you did.
Yeah, and the thing is, you know, we started off this conversation about the microbiomes in our guts. I mean, if we're eating foods like that, what does that do to the bacteria that's trying to keep us healthy?
Yeah, well, the first thing it does is it reduces the number of bacteria. Okay, so we have to feed our microbiome the foods they like. And they don't like these ultra-processed foods for numerous reasons. Not only are the ultra-processed foods devoid of fiber, which we already talked about as being really crucial to maintaining a healthy microbiome, they also have substances in them which actually either reduce the number of bacteria in your microbiome or actually promote the growth of unfavorable bacteria. For example, maltodextrin. Okay, you've probably seen that on the back of many an ingredient label. It's a manufactured chemical. It's a kind of an artificial sweetener, really. But it's been described as being ubiquitous. It's pretty much in every processed food you pick up. Every breakfast cereal, every breakfast bar, every, you know, sugary drink, you know, maltodextrin. It's a cheap, stable sweetener. If you feed someone maltodextrin, you're encouraging the growth of unhelpful bacteria such as E. coli. One of the things we see in patients with Crohn's disease, for example, is they have this abnormal thing happening in their microbiome. They've got this particular E. coli called adherent invasive E. coli, and you can promote the growth of that by feeding someone maltodextrin. And not only does the maltodextrin enhance the abnormal bacteria, it also enhances its ability to adhere to the gut lining. And then other artificial additives such as emulsifiers, carrageenan, polysorbate, increase the ability of those abnormal bacteria to invade the bowel. So food is biologically active. And if you are consuming food that has industrially produced additives in it, it's just not true to think that you can just digest them and off they go and they're just empty calories and they, you know, don't have any effect on your health. The evidence is more and more that these things are affecting your health and not in a good way. But of course, the good news is that you can avoid all these deleterious effects by avoiding ultra-processed foods. And that's why when I speak about a whole food plant-based diet, I put just as much emphasis on whole food.
So explain that term to us, whole foods, plant-based diet. What does that mean?
So yeah, so as I my main area of interest in research is inflammatory bowel disease, Crohn's and colitis. And it was researching, because patients with those diseases have a lot of gastrointestinal symptoms, and they always ask, well, what should I eat, you know? And they're not just asking, what should I eat so I feel better today? They're asking, what should I eat so that I can keep this disease under control, you know? And the more and more that I research this, I'm trying to find an answer for my patients and looking at the existing evidence, and a lot of this evidence is mainstream, it just doesn't get talked about that much. Is that by eating food of plant origin, so that's your beans, your greens, your legumes, your spuds, all those things.
Everything that comes from nature, basically.
Everything that comes from nature. By eating a variety of those foods, eat the rainbow, you are promoting gastrointestinal health and overall health and longevity. And by avoiding these processed foods and, to be honest, keeping your intake of animal-derived products to a minimum, you do improve your quality of life, your duration of life, and reduce your risk of developing serious diseases. So I'm sure, Suzy, you're familiar with Dan Buettner's work in the blue zones, right?
Yes, absolutely, yeah.
Yeah, so for anyone who doesn't know, Dan Buettner's a National Geographic researcher who 15 years ago was sent on an assignment to visit the parts of the world where people lived for the longest and try and identify why are these people living so long. And he identified 5 areas in the world where there was a particularly low risk of dying in your middle age and where there was a particular high risk of living to the age of 100 and being healthy in your 70s, 80s and 90s. And he found these areas in Okinawa, Japan, Sardinia, Italy, Nicoya, Costa Rica, Icaria in Greece, and Loma Linda, California. So he then went to these groups of people living in these areas and he analyzed a lot of their common traits. And one of the things he found common to these disparate groups living in different cultures all around the world was that these people who were living longer, healthier lives were eating a predominantly plant-based diet. 90 to 95% of the calories coming from plants, with the meat either not being there or just being on the side for a little bit of flavor.
All these
so for example,
when they introduced the Western kind of diet, we started turning to the red zones, and that's when we started seeing the introduction of cancers and all these lifestyle conditions.
You're absolutely right. So if you look, so one of the areas they looked at was Okinawa, Japan. So Japan already has a very long-lived population, but in Okinawa 20 years ago, the Okinawans were living for 5, 6, 7, 8 years longer than even the standard Japanese person. And when Dan Buettner analyzed their diet, they were getting the vast majority of their calories from sweet potato. They were getting 80 to 90% of the calories from sweet potato, complex carbohydrates, and then other plants and very little meat. But unfortunately, even in the 10 or 15 years since Dan Buettner visited there first, the dietary patterns in Okinawa have become more westernized. So there's more meat, more processed food, more dairy, and their longevity, the life expectancy in Okinawa has plummeted. So they used to be the longest lived area in Japan. They're right down in the middle now. So still living longer than the people in the West, but on a Japanese scale, not living very long. If you look at the blue zone of Loma Linda, California, where the Seventh-day Adventists live, so they promote a healthy lifestyle and a vegetarian or vegan eating pattern, those Seventh-day Adventists have a life expectancy 10 years longer than the US average. Men live to 89, women live to 91.
Wow. That's good to know. I'm just conscious we've got some questions coming in now, so say hello to a lot of people that have come in. So we have Leah Ashman. Do you know how much HIT, please? Do you know much about HIT?
High intensity something? I don't know what she's referring to there in terms of diet microbiome.
I don't know. I mean, right. If you can come back to us, Lee, and just elaborate a bit more. So Elizabeth is saying I've a B12 absorption problem, but I've got intrinsic factor, so that's what I need investigation. And I can't see her comment.
Okay, so I get that. So that's relating to B12.
She says she gets regular injections for it.
Yeah, so I think when people eat a plant-based diet, they worry about not getting enough B12, and that's if you take a whole population of people and analyze them for nutritional deficiencies, You'll find that people eating a plant-based diet have far less nutritional deficiencies than people eating a standard Western or omnivorous diet. They're certainly far less likely to be fiber deficient, which is my main concern. But people who eat a plant-based diet don't get B12 in their diet. But B12 deficiency isn't exclusive to vegans. It's actually really common in omnivores as well, and it gets more common as we get older. In order to absorb vitamin B12, we need a substance from our stomachs called intrinsic factor. And some people can have a deficiency of intrinsic factor. It's called pernicious anemia. And some people can develop the intrinsic factor deficiency as they age, so they become B12 deficient. So I see Elizabeth isn't able to absorb oral vitamin B12 because she's got intrinsic factor deficiency, so therefore she gets an injection. So that's a really common condition. It's not specific to any particular dietary pattern.
Okay. So we've got Gillian. She's saying her diet was so healthy when she lived in Japan. She felt great and it was delicious.
Of course she did. She was getting her tofu and she was getting her tempeh and her miso soup and her fermented soybeans and her noodles.
And I've got one. There was one from Sean and I've lost it. Here we go. Can I pin this comment now? So, how does food affect your mental health, and how best is the process to move to a plant-based food from current diet?
Yeah, well, there's in terms of mental health, that's an emerging area of research, actually. So when we talk about food affecting our mental health, again, we're right back to the food, gut, microbiome, brain axis, you know. So the gut has its own nervous system called the enteric nervous system. It's just as complex as the nervous supply to your spine, and it's in constant communication with your brain, both up and down, you know. So the food we eat affects our microbiome and does affect our mood. And there's been lots of interesting microbiome research going on, looking at the microbiome within people suffering from depression and anxiety, etc., and then making dietary changes to improve their microbiome and to improve their overall health. And again, the firm message there in terms of dietary change is eating a variety of plants and avoiding the foods, the ultra-processed foods and excess animal products, as we just said. If someone wants to start moving towards a plant-based diet, there's a few nice programs available online. If you do a Google search for the 21 Vegan Kickstart from the Physicians Committee for Responsible Medicine, that's the PCRM 21-day Kickstart. That's a free program. If you have a look, if you're familiar with the Happy Pear, those Irish celebrity chefs, those guys, they run a 4-week online course, which will complete with recipes, videos, Facebook group support and everything. And over 4 weeks, they'll get you pretty much plant-based.
Yeah, I mean, I think that's the key to it. Is that it's just learning to cook and find tasty, delicious meals, because some of the things that we're giving up, they are tasty, and that's why we crave.
Oh yeah, no doubt.
Enjoy them. So if you're taking these things out, you've got to replace it with something that gives you just as much enjoyment. So
absolutely, and I think a lot of people, when they're making the change initially, will find themselves buying things like Linda McCartney sausages or, you know, those sorts of things, just so they can, you know, enjoy those textures and flavors that they're used to while they're making the transition. And there's absolutely nothing wrong with that.
Yeah, it's just learning a whole new way of kind of...
Well, what's interesting, Suzy, is that as you eat these different foods, your microbiome changes dramatically. And there's emerging evidence that, believe it or not, your microbiome has a significant influence on your food preferences. So as you move towards a healthy plant-based diet, your microbiome adapts to that and starts letting you know.
So this changes what we're craving and things like that. So because the comments, so was from Gillian again. She's intrigued by the mental health food connection. And she's saying, let me pin the comment. Intrigued to know why sometimes we crave fatty and sugary foods, and that, I mean, I suppose that's something we've not touched on. What sugar actually?
Absolutely. Well, I guess it's about reward. You know, I think. I mean, so evolutionarily, okay. So the human, the the ape has been on the earth for about 11 million years, okay? And throughout most of those 11 million years, our evolutionary ancestors were living in times of great scarcity. So if they could come across an energy-dense food, gosh, I don't know, like a fig or a fresh peach or something oily or honey, they would, if they consumed that, that gave them a survival advantage. And if we consume those sugary, fatty foods, we are triggering the same reward responses that you get from good news or from having a satisfying experience or gambling or any positive experience. So you're plugging into those same mechanisms.
Okay.
So it's all about serotonin. So you eat those foods, you're hitting that primitive part, that monkey brain that says, great, calories. We're surviving. We're making it till tomorrow.
And I've read serotonin. That's 90% of that's actually in your gut, isn't it? And
it's produced in your gut,
it was in
and your
brain.
gut microbiome has a big role in that.
And serotonin's the happy hormone. This is what affects our mood. And so, if we're feeding ourselves junk,
you're feeding your monkey mind.
Absolutely.
But that being said, Suzy, I mean, the fact is now that if I go to the supermarket, I can hand over £1 and I can buy myself a Mars bar, okay, which has been engineered to be as sweet and sugary and energy dense as nothing in nature.
Yes.
Okay, a Mars bar is sweeter than the sweetest peach and as sweet as the sweetest honey.
You're making me want a Mars bar now. Stop it.
I know. But these foods have been designed like that. Yeah. So you go and you eat one and you're just plugging straight into those primitive reward systems and your body says yes.
And that is the thing, eating a Mars bar or chocolate, whatever it is, over an apple, an orange and all the rest of it, it's like, the orange is just not doing it for me. But if we...
You're right, but I think it's always worth...
It will change.
You're right. The thing about it, so we talked about, you mentioned sugar earlier. So why do you feel different after you eat a donut rather than an apple? They both got sugar in them, but the sugar that's in the apple is packaged with fiber. I talked earlier about how fiber helps your body to control energy intake, helps to promote the release of insulin, helps control your blood sugars, okay? If you eat 6 apples, you're getting the same amount of sugars you get in a Mars bar. But when you eat the Mars bar, you're not getting any of the fiber. You're not getting any of the slow release. You're getting an instant sugar hit. Your blood sugar goes up, then your insulin levels go up, then your sugar level shoots back down. Suddenly your sugar levels are low because your body was expecting fruit, but it got a Mars bar. And then your body actually briefly goes into starvation mode, starts releasing energy, starts putting lipids into your system. You develop lipemia. So about half an hour after that Mars bar, you're slumping and you're thinking, oh, you've got the sugar slump. Already. You're thinking, what do I need now? I probably need a cup of coffee.
We shouldn't just pick on Mars bars. It's any of the chocolate bars. So.
Yeah, sorry, Mars bar.
Yeah, no, we don't.
Other chocolate treats are available.
Exactly. So I'm conscious that we've been on for 40 minutes and I just want to get a couple of quick questions in. And anything that, if there's more questions later, we'll respond.
Sure.
Well, you'll respond. I won't because I don't have a clue.
Sure.
So let me see. Lee came back to us. She says, was anything mentioned about histamine intolerance? And so she said, sorry, I dipped out there for a second. So histamine intolerance? Know anything about that?
I think that there are some diets available online that talk about reducing certain foods that are apparently promoting histamine release in the gut. But apart from some very specific and genuine food allergies, I haven't really seen the evidence to support that sort of dietary change.
Okay. So in terms, one last question I want to ask you, because you are you eat a plant-based diet, and I wonder, you promote it to your patients when you're seeing them, if they're open to it. But how do the other health professionals, because like I said earlier, nutrition is something that divides everybody. How is, we've seen veganism rising. It's now, I think, 7% of the UK, but of the world. But, what is it that health professionals feel about a plant-based diet, and how do they respond to you when you're promoting it?
Well, there's a chap called Dr. Kim Williams, who's the former president of the U.S. Was the U.S. Cardiology Society. I'm sorry, I'm not quoting his qualification properly, but he was the president of the Society for Cardiology in the United States, and he advocates a plant-based diet wholeheartedly because it significantly reduces and can even reverse coronary vascular disease, which is the #1 cause of premature death in the Western world, and it's not inevitable. You don't have to get coronary vascular disease. And his famous quote is, there's two kinds of cardiologists in the world: vegans and ones who haven't seen the evidence. So I'm going to paraphrase him by saying there's two kinds of gastroenterologists in the world. Yeah. Vegans and the ones who haven't read the evidence. So I've been very careful in my practice is to not just start recommending these things to my patients without sharing the evidence base with my colleagues. I've given numerous presentations at my hospital to both my colleagues within gastroenterology and my colleagues in other specialties about why I'm recommending this and making sure that they're aware of the evidence. And several of my gastroenterology colleagues are now referring me patients with inflammatory bowel disease who are interested in using dietary change as part of their management.
And I suppose if you're starting to get results, if you're seeing patients that are not requiring medication as a result of just making dietary changes, whether it's going full plant-based or just making some changes to their diet, then...
Yeah, I would love if all my patients would adopt a fully plant-based diet, but you have to meet people where they are, as I said. I mean, and sometimes it's the small changes, but then, you know, when you demonstrate the impact of that. I had a young woman recently with ulcerative colitis, inflammatory bowel disease affecting the lower part of her bowel. She was really very symptomatic. She actually ended up going on immune suppressing medications. And despite being on those, she was still having a lot of symptoms. So she'd seen another specialist who upped the meds. Didn't make any difference. You know, so she came to see me. I had a long chat with her about her dietary intake and what she was eating, what she wasn't eating, etc. And we just identified a few areas that she could improve in. And one of the things was I gave her the recipe for my green smoothie. So she came back 2 weeks later. I mean, vastly improved. Wow. You know, gone from stuck in the house to better. Wow. You know, and I'm not saying I took her off her immune suppressing medication, but we were able to reduce the dose by half. And hopefully we'll be able to get her off those medications at some point in the future. Okay.
Well, we're going to leave it there. I think we need you to get post your green smoothie recipe in here. Alan is going to be at the Change Your World conference on the 5th of October in Glasgow. If you've not got your ticket yet, why not? But we have a buy one, get one half price. I was going to say free, but that's not the deal. And but Alan is going to be there with a whole range of speakers talking about physical health, mental health, living with happiness, how to have happier relationships. I mean, we've got a whole great lineup of speakers, and yeah, you'll be able to meet Alan in person, ask some questions, and if you've got any more questions, just post them in the comments and we'll get back to you. And well, Alan will get back to you with his pearls of wisdom and top tips for living a healthier life with energy and vitality and yeah, longevity.
Absolutely, Suzy. We've only scratched the surface.
I know.
We'll have a lot more to talk about in Glasgow.
Yeah, no, very much looking forward to it as well. Take care, Alan, and I'll see you soon. And thank you for everybody that joined us.
Bye, Suzy. Bye, everybody.
Bye-bye. Take care.